This is a reproductive anatomy review. The female reproductive system consists of the external and internal genitals, along with the accessory organs known as the breast. The external genitalia is also called the vulva. The appearance of external genitalia may vary greatly among women, and this is because it can be related to heredity, age, race, and the number of children a woman has had. The internal female reproductive organs are the vagina, uterus, fallopian tubes, and the ovaries. The fallopian tubes function as a passageway for an egg to travel from the ovary into the uterus. The ovary's main function is the production of hormones and eggs. At birth, a female's ovaries will house several million immature eggs. No new eggs will be produced after this time. So basically that means that at birth, a female will have her lifetime supply of eggs. This is contrary to males who actually produce several million sperm each day. The uterus is shaped like an upside-down pear. It is a hollow, muscular organ that lies in the center of the pelvic cavity, at the base of the bladder and the rectum, but above the vagina. This is where a fetus develops during pregnancy. The size of a woman's uterus depends on parity, which means how many children she's had, and if there's any abnormalities present, such as fibroids, which can increase the size of the uterus. Women who have not had children, known as nulliparous women, have smaller uteruses than women who are multiparous or have had more than one child. The endometrium is the innermost layer of the uterus, and it is comprised of many blood vessels. The cervix is the narrowest part of the uterus that sits right above the vagina. It is elastic, and the part of the body that dilates during labor to allow the fetus to pass through the vagina and be born. Before childbirth, the external cervical os is small and oval-shaped, which is indicated by letter A in figure 3.4. After childbirth, the external cervical os actually converts and looks more like a transverse slit that resembles lips. That is recognized in letter B of figure 3.4. Breasts, also called mammary glands, are considered accessories of the female reproductive system. They are responsible for milk production and secretion to a newborn. They also transmit protective antibodies from the mother to the newborn via lactation. It is important to understand the organs of the male reproductive system and their specialized functions. The main function is to produce, maintain, and transport sperm, which are male reproductive cells, within the female reproductive tract. It is also responsible for secreting male sex hormones. Testosterone is the most commonly referred to sex hormones when we're thinking about male anatomy, and testosterone is really important because it helps the male develop characteristics such as increased muscle mass, a deeper voice, male body hair distribution, and sex drive. Hormones are a vital part of the female reproductive system, and we're going to talk about three important hormones that include estrogen, progesterone, and prostaglandins. So estrogen is the big hormone we think about when we think about female sex hormones. It is primarily produced by the ovaries, but it can also be produced in small amounts by the adrenal glands and fat cells within the body. Estrogen is the hormone responsible for female sex characteristics, so things like breast development and widening of the hips. It is also really important when we're talking about regulating the menstrual cycle, and it aids in bone development and keeps your bones strong. This is why when women go through menopause and their estrogen levels decrease, they're at a higher risk for osteoporosis because they don't have that estrogen to help them build up their bones and keep them nice and strong. Progesterone is a hormone that's secreted by the corpus luteum, and that structure we're going to talk a little bit more about later, but it's a temporary endocrine gland that the female body produces after ovulation. Basically, it's produced as the follicle starts breaking down. And progesterone is important because it prepares the uterus for pregnancy. And it does this because it triggers the endometrium to thicken. And when that endometrium thickens, it increases the blood supply. And by doing that, the hope is that if an egg is fertilized and implants in the endometrium within the uterus, that it's going to be nice and taken care of. That's why it's known as the pregnancy hormone. It also has a calming effect and inhibits uterine contractions, because when someone gets pregnant, we don't want them to have uterine contractions. We don't want them to expel the products of conception. Prostaglandins are categorized as hormones, and they are produced by cells of the endometrium and aid in the follicular rupture. So that means when the follicle ruptures and the egg is released to be fertilized. So shortly before a woman begins her period, the endometrial cells that form the lining of the uterus make large amounts of prostaglandins. And when these cells start breaking down during menstruation, prostaglandins are released. They constrict the blood vessels in the uterus and make its muscle layer contract, which actually causes the painful cramps that you feel when a woman starts her period. Now let's talk a little bit about what happens during the menstrual cycle. So the pituitary gland is actually what is responsible for hormonal control of the menstrual cycle. And an important hormone that the anterior pituitary releases is called gonadotropin releasing hormone, also known as GnRH. So around the start of menses, or when a woman starts her period, GnRH is released by the hypothalamus. And the hypothalamus includes the pituitary gland. So when this happens, it stimulates the anterior pituitary gland to produce follicle-stimulating hormone, or FSH. This hormone is responsible for maturation of the follicle. So the follicle is basically like a little fluid-filled environment that contains an immature egg, also called a oocyte. Estrogen is also increasing at this time, and estrogen will peak a few days before ovulation occurs. Estrogen is responsible for thickening that endometrium and the uterine lining, and also helping the oocyte mature within the ovary. So basically what's happening now is that the immature egg located within a follicle is becoming mature and ready for fertilization by sperm. And several follicles actually may start maturing as this hormonal change is occurring, but usually only one is going to become the dominant follicle and be released by the ovary. So as all this is happening, luteinizing hormone, or LH, is the other reproductive pituitary hormone. It is responsible for aiding in maturing that follicle, and it ultimately provides the hormonal trigger that's needed for ovulation to occur. And ovulation is just a big word that means when the egg is released from the ovary. Luteinizing hormone will spike about 24 to 36 hours before ovulation occurs, and this hormonal shift is what actually triggers that egg to pop out of the follicle. So that's what happens leading up to ovulation. So now we're going to say ovulation has occurred, and after that egg is released, progesterone is going to take over, and progesterone levels are going to rise for about the next 2 weeks. And when that happens, they are preparing the uterine lining for implantation of an embryo. So the endometrium is going to have a lot more blood flow to it and become very vascularized. And progesterone, like I said in a previous slide, is produced by the corpus luteum, which is a temporary endocrine gland. And it is created when that follicle releases the egg. So the egg pops out of the follicle starts breaking down, forms this temporary gland called the corpus luteum, and that's where progesterone is produced. So if no implantation occurs, if the woman does not get pregnant, progesterone and estrogen levels are going to drop pretty sharply, and when that happens, that's what's going to trigger the endometrium to start shedding. And when it sheds, that's when menstruation or a woman's period occurs. If the egg is fertilized and becomes implanted within the uterus, then progesterone and estrogen levels are actually going to stay high, and that's going to help suppress the spikes of follicle stimulating hormone and luteinizing hormone, and also help protect that fetus as it starts developing within the woman's body. Now let's talk about what happens within the uterus or the endometrium during the menstrual cycle. The menstrual phase occurs on cycles day 1 through about day 4, but it can vary from woman to woman. This is when a woman starts her period, and the endometrial lining sloughs off if there's no fertilization of an egg. Estrogen and progesterone fall during this phase, and the bleeding lasts on an average of 3 to 7 days. Next, we go into the proliferative phase, which coincides with the follicular phase of the ovarian cycle. This occurs between days 5 and 13. During this time, the endometrium will rebuild and become very thick. It can actually become up to 8 times thicker during this phase. The glands within the endometrium enlarge in response to increased estrogen levels. Ovulation occurs on day 14, and then we'll move into the secretory phase, which happens after ovulation between days 15 and 28. At this time, progesterone takes over. So when progesterone takes over, we know that the endometrium continues to thicken and becomes highly vascularized with increased blood flow. This is preparing the uterus for implantation of an embryo. The very last 3 days of the cycle, assuming a 28-day cycle, so days 25 through 28, is known as the ischemic phase. This only occurs if an egg is not fertilized. So if an egg is not fertilized by a sperm, inadequate blood supply to the endometrium actually causes the blood vessels to rupture, and the uterine lining will start shedding. And when it starts shedding, we move back into that menstrual phase. This is a chart that tries to simplify the ovarian and uterine cycles and puts them together so that you can understand it and see it a little easier.